Hi everyone, this is Dr. Stefan. In this video, I'd like to provide you some encouragement that I've seen in a comment that I received on my channel. So for those of you who are being worked up for lung disease, you're being diagnosed with a lung condition potentially, or you're going for tests, you've had maybe a chest infection and you're trying to recover from that. This is a bit of a word of encouragement from one of the people who is watching my videos. So I'll show you the comment right now because I think it's a good one and it's a good starting point, I think, for those of you who are struggling with accepting that you may be diagnosed with a medical condition and how to deal with that. So basically, Paul is saying the following. So apologies for some of the typos in here, but I'll try to read through the comments. So basically, how can you get better? I am being checked for lung disease. Since then, I've been eating well, exercising more. All the symptoms are going, even the breathlessness. I still feel worn out, but even that is going. I was told I had scarring on my lungs, but the lungs are clear. My wife, who is a nurse, said that I could have had COVID and not know. As for the cough, I am coughing less and less, but the last test is coming up. The lung function test was good. So God knows what I had, what I've got or I had. So again, there are a couple of typos in the comments. This is what happens when we type fast on the internet. It's not a problem. But I just wanted to share this with you because I think what Paul is saying here is absolutely correct. In many circumstances, people who get diagnosed with a lung problem don't necessarily need to see that as some kind of a terminal condition or a diagnosis that will forever change their lives for the worse. And I've seen this actually with patients in my practice as well. Those who have implemented lifestyle changes can have actually seen sometimes their lung function improving. Their symptoms improving to some extent. Now, some of the lung conditions out there, of course, we cannot completely cure. And that's a fact of life, unfortunately. We can try to assist as doctors with the best practices out there to try to offer you treatments as per guidelines, as per common practices. But at the end of the day, lifestyle changes and what you do with your own body does dictate to some extent how well you will cope with lung disease. So whether that is interstitial lung disease or lung fibrosis, as was mentioned here in the comment, or COPD, asthma, bronchiectasis, recovering from a chest infection such as COVID, for all these things, lifestyle changes can play a huge role. And I've mentioned this in previous videos as well because I think it's hugely important, and we don't talk a lot about prevention and lifestyle changes to improve lung disease. And I think through this channel, I will try to share more of these experiences and comments and little tidbits from my own practice that I've seen that could be inspiring for some of you. Because, for example, in the case of interstitial lung disease or lung scarring, as was mentioned in this comment, in many cases, these conditions can be progressive, so they can get worse over time. If that's the case, you can expect that you may become more breathless as time goes on, but you start off from this baseline. So if you don't do anything and you enter this vicious cycle where you do less and less and you become more breathless, the condition progresses and you do less and less and less, that process of decline accelerates. You enter this vicious circle. If you break that vicious circle, and this has been recommended in many guidelines to go to pulmonary rehabilitation, exercises for the lungs, things like that. If you try to break that cycle of becoming more sedentary and doing less because you're breathless, you're not training your respiratory muscles, and you're actually finding it harder to cope with the condition. So if you break that cycle, you can actually get a little bit of an uptick in your lung function, for example. So say if you're carrying a bit of extra weight, if you lose some of that weight, it's possible that your lung function may actually improve. You may become less breathless because you don't have to expend as much energy to move around, to do things. Then, if you are exercising and if you are eating well, you're sleeping well, you're trying to manage stress, all of these things will play a role in managing your body's metabolisms, in just making sure that everything's operating optimally in your body, all the body systems. It's a wholesome approach. That will probably lead to some changes in the immune responses related to that lung condition that you're suffering from. So you may get some improvements from there. So these things work. I wanted to just share the comment with you because I know that this works. I've seen it in practice. And there's a huge difference between patients who actually implement lifestyle changes and those who don't. And it's unfortunate because even with the best medicine in the world, we need to take control of our bodies as well. So I'm not saying this to shame anyone or to push anyone to go overboard with diet, with exercise, especially if you are really struggling with your breathing. But what I would suggest is that you try to discuss with your doctor and see what you can implement in your case, because I'm sure there could be simple exercises that you can incorporate. So, for example, if you're going to pulmonary rehabilitation classes, which are run by a physiotherapist, they can assess you, see how much you can do. Maybe you're at the point where you're finding it hard to get out from your chair, from the sofa, and moving around. That's okay. We start from there and we just repeat what you can do until your body gets a little bit stronger. That will help you cope with your conditions. If you're struggling with all kinds of other symptoms, discussing this with your doctor and seeing what symptomatic treatments could be done so that your symptoms don't limit your life in such a way that you enter that vicious circle that I mentioned of decline, more symptoms that prevent you from doing more a lot, and then you get worse. If we break that somehow, we may get better outcomes. And this comes on top of medication. And just a word about infections. So some people will get chest infections when they have chronic lung disease. This can be an important setback because it can take up to 2 months, even for a healthy person, to recover from a chest infection, especially a bad one. So say you've had COVID, you've had a pneumonia. It may take up to 2 months to recover back to the baseline you were at before you had that infection. So it's really important in that time after the chest infection to try to incorporate as many of these lifestyle changes as you can. For example, if you're smoking, it's probably a good idea to quit. Your body is telling you something. If you weren't active before the chest infection, maybe try to slowly get into the habit of doing a little bit more. If your diet wasn't on point, maybe it's important to read some books on good diet. There's plenty of information out there. You can even consult a dietitian, or at least seek advice from someone who seems to be having a good diet, because it can be a pleasure to have good food and things that really make you healthy. And that will accelerate the recovery process from those infections or those setbacks that may occur every now and then. I hope this was encouraging for you. That's what I wanted to achieve through this video. If I've achieved that, I'm really happy. If I haven't, please drop me a comment. Tell me what other questions I could answer, because I would really like to promote better lung health for everyone through this channel and do a small part if I can. Thank you very much for watching. All the best and good health.